See?
That is it.
Thank you very much, Chairperson. Good afternoon, Premier of KwaZulu-Natal, Comrade Sihlezi Galala, fellow members of the Executive Council, members of the Legislature, Amazinyane Silo, Anathi namhlanje, Inkosi uQhiliza, Chairperson of the KwaZulu-Natal House of Traditional Leaders, mayors, councillors, and amakhosi that are with us, Deputy Chairperson and members of the Provincial AIDS Council, ubaba udokotela uSandile Shabalala, Dr. Muji nobabushezi from the Department of Health and all other management. Ngifisa ukubingelela ngokukhulu ukukhethekileyo ubaba uNhlonipho Zulu okuyena yena owasiza ukubelethisa omunye womama bethu ngesikhathi bejikisiwe esibhedlela sethu unathi la namhlanje siyazi ukuthi usilalele. Ngicela ukubingelela ngokukhulu ukuyithoba umndeni wakwaGwala okhona nathi. Ngibingeleleke ama-food soldiers ethu, all the healthcare workers esinawo, distinguished guests, people of KwaZulu-Natal, members of the media, ladies and gentlemen, good afternoon. Honorable Chairperson, we deliver this budget speech under the theme #KZN Healthcares, improving infrastructure, improving waiting times, improving quality and access to healthcare for the people of KwaZulu-Natal. This is in keeping with our new departmental motto that says, and I quote, "My health, your health, our health, a healthy KwaZulu-Natal." As we continue to commemorate the spirit of our fallen heroes during Youth Month, we remember the selfless sacrifices of our soldiers such as Pila Posha Ndwandwe Wasemlazi. She is one of our female heroines who made huge sacrifices during the armed struggle. Through her involvement in the liberation movement, she was a 25-year-old breastfeeding mother who was then abducted by the apartheid forces in 1988, and they wanted to force her to become an informer for the then apartheid government. When she refused, she was tortured for 10 days and subsequently shot in the head, buried in a shallow grave, eLandskop. This year, Chairperson, we are also celebrating the centenary of the birth of Comrade Henry Kwala, popularly known as the Lion of the Midlands, who was born on the 30th of July 1920 and passed away exactly 25 years ago on the 20th of June 1995. Umdamdala, as Ubabu Kwala was affectionately known as a revolutionary, was harassed, persecuted, and imprisoned on Robben Island on 2 different occasions. He was first arrested for sabotage and tried and sentenced to 8 years between 1964 and 1972. After his release from prison, he was rearrested in 1975 for treason now, and this time sentenced to life imprisonment and subsequently released in 1988 due to ill health. However, throughout his trials and tribulations, Umpepete remained courageous and steadfast in fighting for the liberation of our people. And he continued to be the beacon of hope for the people of KwaZulu-Natal and South Africa at large. In honoring the legacy of Umdala, we have made a decision to rename Edendale Hospital after him. This is informed by the fact that this hospital has its own history, its own rich history in the struggle for liberation as well. We have engaged the Kwala family in this regard, and they have honored us and agreed to lend us the name of this struggle icon. We had also started discussions with the district and local municipalities of Mkungundlovu and Umsunduzi respectively in this regard, as per standard procedure, and we will be continuing with these talks emva COVID-19 uma sesikwazile ukuthi siqhubeke. In line with this decision, the department has also decided to revamp the hospital, while also working to improve staff attitudes and overall client experience, in order to ensure that this facility is a reflection of the true stature of the man. Indeed, today we stand on the shoulders of giants as we work to improve the lives of our fellow compatriots through ensuring better access to quality healthcare services. Chairperson, we deliver this 2020-2021 budget vote speech amid ongoing turbulence and uncertainty all over the globe due to the novel coronavirus 2019. I will later elaborate on the approach we have taken as a department to fight this COVID-19. For now, I wish to remind this House of some of the commitments that we made when we presented the previous budget and how far we have gone with its implementation. Chair, on addressing staff shortages, in our previous budget speech, we referred to an impassioned plea that we had made to our honorable Premier, Comrade Sihle Zikalala, to consider our proposal for a minimum staff establishment approach at all our healthcare facilities. We were of the view that having at least 60% of the staff complement at our facilities could begin to address challenges caused by understaffing, such as low staff morale, low quality of care, and burnout as a result of overcrowding. The Premier made it clear that in order for us to achieve this approach and for the provincial government to even consider our proposal, we would need to cut the fat at head office and at district levels, but also optimize the resources that we have as the Department of Health. Engagements in this regard had already started, and we were in the process of implementing this approach. We had proposed 60% minimum staff establishment and had started official engagements within the provincial government. Of course, then COVID happened and everything else was stalled. Chair, we remain confident, however, that in due course, this matter will receive the attention that it deserves, as the Provincial Executive Council had already confirmed its commitment towards solving the challenges that are faced by the Department of Health in relation to its human resource capacity. Chair, let me speak on an issue that we call e-health. In the last budget speech, we indicated that we would be introducing an e-filing system. However, in the process of implementing this system, our approach evolved, and we realized that the department actually needed an e-health system that provides a wall-to-wall digital solution from the moment a patient enters a healthcare facility until they leave. As a result of the old paper system utilized by the Department of Health, files are always at risk of getting lost or of being stolen. And clerical staff have to spend hours looking for them, while sick patients are forced to wait for a long time in the queues. Some files get lost, while others get stolen, all of which makes it difficult for the Department of Health to defend itself adequately during litigation, should it come to this. Chairperson, we staged a surprise visit at Kwamsane Clinic in Mtubatuba beginning of this year, where we actually got first-hand experience of this poor filing system. Angikusho nje sihlala ukuthi kwasithatha ama-hour nama-hour ukuze sikwazi ukuthola ama-file ama-patients ayekhona. Sisebenza ndawonye sibambisene ne-clerical staff yaleya clinic. Okwasikhombisa ngempela ukuthi kunzima kangakanani umsebenzi owenziwa yi-staff in relation to this. This was but a microcosm of some of the frustrations that the public and our staff face on a daily basis. This new IT system, esikhuluma ngayo, has been developed by a group of young people after we convened what is called a hackathon. This hackathon is a meeting normally chairperson put together by those that are in the technology space. Whenever they want to come up with a new system, they put their heads together for 3 days and come up with a system that is relevant. That is exactly what we did, chairperson, and we were able to get a system that is going to assist the Department of Health, and we are going to be utilizing in the whole province. Let me then speak to the new interventions that we have in the province, Chair. The majority of the commitments that we made in the previous budget speech are part of the new interventions. Reducing the trauma of loss, new protocols for the management of intrauterine deaths. Chairperson, it was brought to my attention that a number of women who had suffered intrauterine deaths, what is called IUDs, were being made to go home and wait for the natural delivery process to take its course. In other words, sihlalo umuntu wesifazane uma ngabe ukhulelwe kwenzeka ingane ishone isesiswini kungakafiki isikhathi. Njengomnyango wezempilo besivele ingane umuntu wesifazane simbuyisele ekhaya sithi akahamba yolinda khona ingane kuze kube yiyona eziphumelayo. Kuyenzeka ukuthi iphume ingane emva kwa7 days, kwesinye isikhathi kube 14 days. Isikhathi eside kakhulu. In some cases, these mothers were being kept in wards with other women who would still be waiting to deliver their babies. Sometimes they would be sent home to wait for the natural birth process to take place and only come back when they were going into active labor. All of this was taking a severe psychological and emotional toll on mothers with IUDs. This had the potential to cause psychological trauma and clinical complications on the affected mothers. It also exposed them to potential risk of maternal death and other complications, since they may not be exposed to proper clinical monitoring at On further scrutiny, I was advised that these protocols were protocols that were being implemented by government across. Chairperson ngavuma ukuthi cha lokhu akuzukwenzeka kuseyimina ungqongqoshe, and I said not under my watch. That is why, Chair, we then decided to change the protocols. And these protocols, we understood that it does not happen or they are not implemented in this particular fashion in the private sector. And it then created an impression that poor women are being punished for being poor. Therefore, as the government, we decided to change the protocols, Chair. Now, with the new protocols that we have put in place, mothers who have an IUD are removed and placed in a ward away from other mothers, where they are offered continuous counseling and given a chance for induction of labor, should they choose to do so. We firmly believe that this is a much more humane way of dealing with such a situation, and it reduces the emotional distress, trauma, and stigma to mothers who are already bereaved. On expanding the capacity of healthcare facilities, Chairperson, generally, apartheid special development in the province of KwaZulu-Natal always focused on the Natal part at the expense of KwaZulu. Remember, KwaZulu, yilapho indawo zakhona egcwele khona kobantu, kugcwele the rural areas. Therefore, uhulumeni wobandlululo wayefocuse eNatal, engayithuthukisi indawo lapho abantu ababehleli khona. The resultant legacy of this is that many as 4 of ama-districts aKwaZulu-Natal, sikhuluma ngomzinyathi, uMkhanyakude, iZululand neHerigwala, awanayo ngisho eyodwa isibhedlela esibizwa ngokuthi i-regional hospital. Inkinga-ke yale sibhedlela sihlalo ukuthi siyisibhedlela esinama-specialties asethini lawo adinga ukuthi abantu uma sebegula at a particular level kufuna bakwazi ukuthi badlulisele yona. Manje kunama-district awu-4 esingenawo thina or angenawo ama-regional hospital, okwenza kube inkinga kakhulu. The Department of Health has uma ngabe i-patient idinga i-regional service in these 4 districts sihlalo, i-Department of Health umnyango kufuna uwa-transport ama-patient from a district abahlala kuwona, from a district hospital to a regional hospital. The transportation, staffing, and meals is costly to the government and comes at a huge inconvenience to the patient themselves, sometimes even at a cost of lives while patients are being moved, so that they can access these regional services. And to prove our point, ngo-2019-2020 umnyango wezempilo uspende imali ecishe 24 million rands transporta nje ama-patients eZululand. Angenze nje isibonelo ukuthi ukuze i-patient iye eNgwelezane esibhedlela, umnyango had to facilitate 18,978 patients iba move around. Now, lama-patients lawa aqhamuka eMkhanyakude district and aqhamuka ibhedlela ey'fana noHlabisa, eManguze, eMselene, eMossford nase-Bethesda Hospital. Bonke kufuna bamikiswe eNgwelezane ukuze bekwazi ukuthi bathole le level ye-service esikhuluma ngayo. And as well as 9,449 patients in Zululand district in respect laba-ke baqhamuka eBenedictine nase-Tshelejuba esibhedlela. It is also worth noting that over and above these patient movements, a total of 5,705 and 3,226 patient relatives were also transported as patient escorts from uMkhanyakude and Zululand district respectively. Ngoba kuyenzeka sihlala ukuthi iy'ngane esingakwazi ukuyihambela zodwa, kufuna zihambe nabazali bayiphelezele, noma umuntu emdala egula but adinga ukuthi umuntu aphelezelwe. Nabo bonke labo bantu siyabatransporta siwumnyango wezempilo, and leyo mali leyo iningi kakhulu esiyisebenzisayo. Siphinde sibasuse kuma-district abo sihlalo sibabikise ey'bhedlela ey'fana noNgwelezane njengoba bengishilo, eKing Edward, eNkosi Albert, St. Aidan and Smecots, King Dinizulu and Ellington Hospital. Bonke ngiyalokhu sihlalo
Can I disturb you?
Yeah, but
There's sound at the back. Please, IT, can you sort out that? It's disturbing the MEC. Thank you. You may continue, Honorable MEC.
Thank you, Chairperson. For context, a regional hospital would normally provide a package of services, which includes internal medicine, obstetrics and gynecology, general surgery, psychiatry, anesthetics, maningi Chairperson ama services are provided by a regional hospital angekho at a district hospital. Therefore, upgrading some district hospital in these 4 districts so that they offer these regional level services, the Department of Health would make a massive saving on its already limited resources. As part of this approach, we will also endeavor to attract and retain medical specialists in these areas, while we are very much aware, Chairperson, that it's not going to be an easy task because we are talking about districts that are in rural settings. Because we are mindful of the reluctance of some medical specialists to work in the rural areas of the province, we are also considering utilizing sessional doctors as well as utilizing technology to bridge the skills gap that is going to be there. Ibhedlela ke sihlalo esizoyishintsha kuma district, iFryhead Hospital, Bethesda Hospital, iDandi Hospital, neChrist the King. Asizozakha kabusha, we are just going to convert the services and add izinto esidinga uku-addwa in relation to those particular hospitals. A new tertiary hospital north of the province. Ideally, Chairperson, given the population size and the vastness of the province of KwaZulu-Natal, we ought to have at least more than three tertiary hospitals. For a province of this size, it is an anomaly that KwaZulu-Natal only has 2 tertiary hospitals. Therefore, I have decided, Chairperson, to build a tertiary hospital in the north of the province. We have already identified a site adjacent to Welezana Hospital for this purpose. This will ensure that the people of the north of the province also get this specialized healthcare closer to their homes without having to travel for hours and hours on end. Chairperson. And we'll also be emphasizing that the province of KwaZulu-Natal is not only in the urban centers, but even the rural centers, they deserve to get the care that should be provided to them. Chair, on strengthening primary health care through a community-based approach, as the African National Congress had declared in its policy document, Ready to Govern, there is a need, and I quote, for a comprehensive health service that promotes good health, prevents illness, provides care, and rehabilitative services to the ill, close quote. An effective healthcare system is one that is rooted in the primary healthcare approach and is underpinned by a culture of disease prevention and health education, particularly in a developing nation such as ours. Some of the advantages of this approach include early detection of disease, taking services closer to the people, including early management of health conditions. In implementing this people-centered approach, these are the programs that the department has started to implement. Ngizozibala nje sihlalo ama-members azoyifundela ama-details awo later on uma sewehlele ekhaya. Eyokuqala yilesi ibiza ngokuthi isibhedlela kubantu that takes all the services to the people, ibamikise nje ama-services wonke iwalethe kubantu as they are. The second one is a program we are calling Nkosi Khulekile Ekhaya, and this will literally go to people's homes and bring our teams of doctors, nurses, and community caregivers so that we are able to facilitate a proper and comprehensive healthcare service as a kind. The third program is the program that we call Fabulous About Health. This sexual orientation, Chair, is a constitutionally protected right. Furthermore, the Center for Disease Control is very clear about the position of people from the LGBTQI+ community in our societies. The CDC observes that, and I quote, people who are lesbian, gay, bisexual, or transgender are members of every community. They are diverse. They come from all walks of life and include people from all races and ethnicities, all ages, all socioeconomic statuses, and from all parts of the country and the world. The perspectives and needs of LGBTQI+ community should be routinely considered in public health efforts to improve the overall health of every person and eliminate health disparities, close quote. As a government that is in touch with reality, we are aware that members or some members of the LGBTQI+ community feel sidelined and misunderstood. As such, they have complained about experiencing difficulties in accessing healthcare services that all of us are entitled and those that are specific to them. We have then introduced a new campaign known as Fabulous About Health, whose aim is to improve access to healthcare for the LGBTQI+ community. This campaign is made to highlight a program that we have established to promote LGBTQI+ friendly healthcare facilities. Again, We will continue to strengthen and broaden this program. As part of our LGBTQI-friendly approach, we will provide a package, and this is a new approach. We will provide a package of service that will include in them loops, dental dams, and finger gloves, and hope that we will be able to assist in their healthcare. We are making this commitment cognizant of the fact that this will come at a very high financial cost to the department, which is why we will be using it, or we will use a phased-in approach so that we are able to implement it in full eventually. The next program that we are implementing is a program called the Kosombela Machita Health of Men. Chairperson, this is a program that is very much similar to a program that we are running called Isibaya Samadota. However, having understood that Isibaya Samadota often resonates with men in rural areas, we decided to implement a program that would be very much in line with that program, but speaks to an urban man. And this program talks about the sexuality of men, talks about gender-based violence, and talks about anything that men actually need to be able to talk to each other about, but also understand and promote them and encourage them to come to the facilities of the Department of Health. On establishing, Chairperson, a culture of responsible, responsive, and accountable governance. Due to a number of service complaints directed to our office and myself in particular, it became clear that there was a gap between the public and a gap between the public that we were servicing and management at facility and head office level. I therefore decided to publicize the names and contact details of all hospital CEOs, district directors, management of EMS, and management of forensic pathology services for everyone to know and understand and call whenever they have challenges. This is part of our effort to improve quality, reduce waiting times, improve overall client satisfaction, all of which is towards the realization of the Make Me Look Like a Hospital program. In line with the principles of Batupili, this ensures that the public knows those who are leading these facilities and that these leaders are available to help communities when challenges arise, and they should be able to do so. And we've also then, Chairperson, established a mobile app, which is a complaints management application. We have also completed the development of this mobile app that is able to act as a link between the department and the public. This app is managed by trained department staff who also manage our social media, media pages. We will further increase capacity in this regard, Chairperson, moving forward. These platforms are meant to make the people of this province feel that the department cares about them and is willing to intervene to help them as much as possible. And you would know, Chairperson, those who have actually indicated and have sent some complaints through any of these platforms, we have responded to them, Chairperson. Chair, the following is an issue, the programs that we have that are relating to institutes of higher learning. I hope members are going to be able to speak to that. But I do want to indicate that we have also implemented, Chair, what we are calling a full assistance for our bursary holders. For far too long, our bursary holders have been subjected to an untenable situation whereby they would sometimes get partial financial coverage for their tuition, meals, and stationery and accommodation fees. As a result, many students would be left in limbo. They would get tertiary fees, but actually in the Imali accommodation, Chairperson, and make it very difficult for our learners to actually continue with their education. And as a result, some of them would be forced to look for alternative means to raise money, including making themselves vulnerable and living in unsafe areas. As a mother, Chairperson, you would know that these are some of the issues that we would be worried about. Ukuthi ingane zethu zamantombazane uma sema-tertiary institution azingabi zibonakala seziba vulnerable just because government is not taking care of them. Ingakho-ke sithatha isinqumo sokuthi uma ngabe ibhasari ikhishwa, ayikhishwa yonke so that ingane ikwazi ukuthola yonke into edingekayo esikolweni. Sesinqume-ke nosihlalo nokuba edela ama-laptops njengoba sikulesikhathi se-COVID, ngoba siyazi ukuthi kuyafundwa virtually, but those holders of the Department of Health abakwazi ukuqhubeka afunde behlele emakhaya, behlele endaweni zasemakhaya ngenxa yokuthi abanayo i-platform yokufunda. So we are adding ama-laptops. Ukusuka next week nje head of department is going to start rolling out indaba ye-access yama-laptops to those that are bursary holders of the those that are bursary holders of the Department of Health, brought to them by the African National Congress. Chairperson, I'm going to speak about the return of Cuba-based medical students. We've got them there. 95 of them are coming back this year, but we continue with the program. Let me then go to the next point, which is the reviving our relationship with traditional health practitioners. Chairperson, up to 80% of our population are believed to use the services of traditional health practitioners in one way or the other. It therefore follows that traditional health practitioners should be recognized as part of the value chain of health. Traditional health practitioners have also been identified as a vital source for upscaling comprehensive HIV and AIDS, TB, and other chronic diseases. In recognition of all of this, we have taken a conscious decision, Slalo, to resuscitate a formal partnership that existed between the Department of Health and the traditional health practitioners as firstly initiated by MEC NKWANYANA when she was MEC for Health. In fact, when the national lockdown was announced, Chair, we were already at an advanced stage of preparing for a conference to cement these relationships and find effective ways of working together and working with each other. Moving forward sizokwazi ukuthi sheshe si-implemente ngoba abantu ababaluleke kakhulu la bey'mpilweni zethu. This common cause, Slalo, that before Western medicine came into Africa, Africans were able to heal themselves and each other through the indigenous knowledge that we had, and we understood how we utilized our herbs. We are advocating for this because, Chairperson, in many instances, the medication that many of us pay exorbitant amounts for is derived from traditional medicinal plants from Africa. We've also decided to form an advisory committee that we will be working with very closely within the Department of and the MEC. Ngoba Slalo siyafisa ukuthi i-Western medicine understand ukuthi kufuna ilingane ne traditional medicine that is used in South Africa, but in KZN in particular, ngoba sabantu abaningi abakwazi ukusebenzisa leyo medication leyo. In reducing the burden of disease, Chair, KwaZulu-Natal continues to be the epicenter of HIV and AIDS in the country. According to the Tembisa model, about 2.03 million people in KwaZulu-Natal are HIV positive. Out of these, 1.4 million are on treatment and 490,000 are HIV positive but not on treatment. The districts with the highest rate of patients lost to follow-up treatment are eThekwini, uMgungundlovu, uGwilembe, uMkhanyakude, and Zululand. The department is targeting the following high-risk groups: women aged between 15 and 24, men generally, the LGBTQI+ community, men who have sex with men, sex workers, truck drivers, minors, and farm workers. We are targeting these groups through tangible programs and a number of awareness campaigns. Let me speak to the 1990 targets, Chair. The UNAIDS has given us something that is called 1990 strategy and targets, which we must meet by the end of 2020. These targets require of us to ensure that 90% of HIV-infected people should know their status. 90% of those who know their status should be initiated on ART. And finally, 90 of those that are on ART should be virtually suppressed. As a province that is striving to achieve epidemic control, we are extremely pleased to be the first in the country to have 3 districts, which is uMkhanyakude, Ugu, and Mzinyathi, to achieve these 1990 targets. Our minister, Dr. Mkhize, congratulated these 3 districts and even visited Ugu and Mkhanyakude. And when lockdown happened, we were planning on going to Mzinyathi so that sikwazi ukuthi nabo sibagqugquzele nalawo amanye ama-district asasele. We are hoping ukuthi azofika and bese kwafuna by March ese-achieve target. Lawa seyidlulile target Slalo, target yabisiyanyuka ke manje siya ku 95, and by next year siyathemba ukuthi zobe sesifikile lapho. On HIV testing, our target for HIV and AIDS testing for the 2021 financial year is 3.3 million people. By the end of quarter 3 in the previous financial year, Chair, we had reached 3.2 million, which means we had reached and we are about to surpass our target. Our intervention to reduce the number of people lost to treatment, ziningana, and we have decided that we must be able to get our people to be active. We have community workers as well targets, Chairperson, on reducing mother-to-child transmission in the last financial year. The rate of mother-to-child transmission around 10 weeks was 0.56%, which exceeded our target of 0.8%. This is in line with the elimination of mother-to-child transmission South Africa 2021. To sustain this achievement, we will continue with this particular plan. On TB, our endeavor to find all TB patients and to initiate them on treatment, we are using universal screening in health facilities and in the community. In HIV-positive pregnant women, universal testing for TB and first ANC is vital in ensuring prompt diagnosis and treatment to prevent complications in the pregnant mother and to protect the unborn child. Infection prevention and control practices have been enhanced through gazetted health infrastructure norms, which the province has adopted and implemented. The TB prevention and control program has introduced new diagnostic tools to assist with the diagnosis of TB in children and HIV-positive patients. We have implemented a number of test chairperson, and those are written there. Members will be able to read for themselves. And we have a number of gains that we have reached, or targets that we have reached in relation to TB, and we've indicated those in our speech, Chair. On screening and testing for cervical and breast cancer, in the past financial year, we screened 81.9% of eligible women for cervical and breast cancer against our target of 85%. Out of those, a total of 3,471 women were referred for the LETS procedure. This procedure gets rid of precancerous cells without much pain and can be moving anywhere because it is a mobile kind of an equipment. And it does this in a short space of time and can be moved and around into our clinics. And some of our clinics actually have this this machine. On reproductive health care, Chair, we have we continue to call on our people to take care and make sure that they take the reproductive health into their hands, make sure that this becomes something abayithatha serious, because we have a responsibility to take care of our reproductive health. What we've also done and we continue to do is to distribute our condoms, Chairperson. You will see the numbers there. While we distribute male condoms, but we also decided to target and focus on female condoms because they also need to be given the condoms just like the males, because reproductive health is for both, or it's for all genders. Chair, on choice of termination of pregnancy, we support and emphasize the right of women to access reproductive health services in their entirety or terminate their pregnancy should they choose to do so. Over the years, the exercise of choice of termination of pregnancy had visually disappeared from the public agenda. It was also brought to our attention that pregnant women who need to terminate their pregnancy during the second trimester were experiencing difficulties in accessing this particular service. Currently, the CTOP service is provided in 53 healthcare facilities in the province, and 39 hospitals and 14 community healthcare centers. The sixth administration has also set up new protocols for the transportation of women with advanced pregnancies who need to terminate their pregnancies in line with the law. The rationale for this is to promote the safety of clients who require this service during the second trimester between referring facilities. The procedure for arranging transport now unfolds as follows. When a client is requesting this service and is eligible for it, but presents at a facility with a 24-hour maternity service which does not offer the required service, it is the responsibility of the healthcare worker in the facility to secure an appointment on the earliest date possible at a facility that actually offers this particular service. Chair, we speak to the child mortality and the mortality rate in our speech. Generally, the leading causes of maternal mortality include hypertension, complications related to HIV, and excessive bleeding. As a department, we are extremely pleased to note a significant improvement in this regard, as we have now reduced the rate of maternal mortality from 100 mothers per 1,000 people in 2018-2019 to 77 mothers per 100,000 people in 2019-2020. Of course, Chairperson, we are still not happy with this, because even any death is a death that is not acceptable. The progress we have made can be attributed to the improved management of hypertension during pregnancy and the usage of a new garment which prevents post-birth excessive bleeding. The Universal Test and Treatment Program has also been extremely helpful in initiating HIV-positive mothers on treatment during the early stages of pregnancy. Chair, we also want to speak a little bit on the issue of severe acute malnutrition. The numbers are there. We must indicate that we are not happy. We are slightly higher than the target of the province. We are at 6.9 instead of 6%. But we want to indicate this. This has absolutely nothing to do with the fact that there was a lockdown, because now it's beginning. This is beginning to be made a political issue in relation to that. On non-communicable diseases, Chair, these continue to be the biggest burden on our budget. Some of these ailments are preventable, such as diabetes, obesity, hypertension through lifestyle modification, including Chairperson, let me speak to the issue of CCMDD. There has been an increase in the number of patients introduced to the CCMDD program over the past financial year. The number has grown from 1.02 million at the end of the last financial year to 1.26 million currently. This represents an overall increase of 159,000 newly registered patients. Chairperson, we have also decided in expanding access to treatment for patients with chronic diseases in underserviced communities. We will also be implementing a pillbox system. This will be a quick, convenient, and cost-effective alternative medicine parcel collection system, so that abantu bakithi bangadingi ukuthi balinde kuma-queues isikhathi eside kakhulu. On medical legal centers, Chair, I will just indicate that we have started implementing the 4 centers of excellence, and we've increased with 1 centers of excellence that are going to assist us in the reduction of the medical legal, and we have started the process of employing all the allied workers that are needed there, including the issue of our e-health, Chair, because it speaks to this. It speaks to that. On universal health coverage, the COVID-19 epidemic has shown once again that the state is best positioned to provide universal health care. Contrary to the perceptions that the private sector provides a superior level of care, a disproportionate number of the COVID-19 deaths came from the private sector, raising serious questions about the quality of care rendered there, as well as their preparedness to deal with the epidemic. Sihlalo lokhu kuyakhombisa nje ukuthi i-NHI kufuna ngabe sifikile ukuze abantu bakithi bakwazi ukuthi bathole usizo olungcono lwezempilo. On tackling COVID-19 head on, Chairperson, COVID-19 was first detected in the Chinese province of Wuhan on the 30th of January 2020. The World Health Organization declared it as a global public health emergency. On the 5th of March, South Africa received its own first case, which happened to be here in the province of KwaZulu-Natal, just outside of Pietermaritzburg. And then on the 11th of March, having infected more than 118,000 people and killed close to 4.3 thousand people globally, COVID-19 was declared a pandemic. Today, barely 5 months after the disease was first discovered, there are 6.6 million COVID cases globally, 388,000 deaths, and 3.1 million recoveries in the world. In South Africa, Chair, because I think we need to read the statistics. In South Africa, we, as a province of KwaZulu-Natal, we have confirmed 2,869 cases. We have 55 deaths, and we have 1,260 recoveries. Needless to say, Chair, because of COVID-19, life as we know it has changed, including all the plans that we had put in place, both for ourselves and as individuals, but as government. Confronted by the harsh realities of the deadly COVID-19, we have had to suddenly reprioritize the creation of capacity in terms of human resources and best to accommodate patients to quarantine and isolate for isolation purposes. This has been done to ensure that when COVID-19 reaches its peak, we are able to respond effectively and adequately in order to avoid a complete disaster. In preparation for COVID-19, we decided on a phased-in strategy based on 1, stakeholder engagement, Chairperson, and we've written down there all the stakeholders that we engaged. Phase 2, community engagement, which comprises of mass communication as an effective tool out to communities, and after lockdown, we had to think of other ways, which included the erection of billboards, issuing of posters, pamphlets, and so forth. And thirdly, third phase, the third part of our strategy was ensuring that our facilities are ready, Chair, for the onslaught. An unfortunate negative outcome of the government's swift and decisive action to contain COVID-19 has resulted in people thinking that the virus either does not exist or is very far from them. Denialism. Their mindset seems to imply that just because their neighbor or family member has not been affected, therefore they are safe from COVID. We once again wish to urge our people to acknowledge that COVID-19 is here and can be deadly in dealing with, and it can be deadly, Chairperson. Therefore, we can never overemphasize the necessity of taking the following precautions as prescribed by government, such as regularly washing your hands, wearing of masks at all times, and practicing social distancing. We are greatly concerned by the growing stigma against people infected with COVID-19. We have observed that in certain communities, when families are fed from home by our teams after testing positive so that they be isolated, they get labeled. It is as if being fed from home is some kind of curse for the neighborhood, when it's actually no different than when a sick person is fed from home by in our ambulance. In this regard, we appeal to our fellow compatriots not to discriminate against those who test positive, but instead show them the love and support that they need. This virus can infect anyone at any time, and we must treat those who test positive as we would like to be treated if we were in their position, as might be the case, just by the way, Chairperson. We are also concerned about the actions of those who do not want to get tested for fear, Chairperson, because then that spreads the virus. On establishing additional COVID capacity, as a province, we have moved with great speed to increase human resource and bed capacity in order to accommodate patients who need to be quarantined while waiting for their test results, and isolate and treat those who have been tested. In just a few months, we have created 7,111 beds in the province through extensive renovations and repurposing of our own hospitals, establishing of field hospitals, and establishment of temporary structures. Such hospitals that we have been repurposed include, amongst others, Clarewood Hospital, Wentworth, Richmond, Yindegakuli, Listislan. The Royal Showgrounds has been created into a field hospital, and it's going to give us 254 beds. Right now, and it's Mkungundlove, and it will service abantu basemkungundlove herikwala naso together. Right now, the Durban Exhibition Center is being converted to become a field hospital, and in this regard, the National Department is assisting us. We have started to erect a few temporary structures, starting with 4, which are in Clarewood, Ilembe, Naseking Tetwayo, Slalo. But should we need more beds, we will then start rolling out in the other areas. We are also utilizing a few hotels, B&Bs, and resorts so that we are able to get their beds and utilize them for quarantine purposes, and that's going to be more than 4,000 beds. In response to the COVID-19 pandemic and in light of the staffing challenges that we have had, we have added staff to the facilities where we are creating additional bed capacity, and in facilities where we have created field hospitals and temporary structures. We have started hiring more than 8,000 people who are going to be employed in the 4 different categories: professional nurses, staff nurses, specialty nurses, ward clerks, and general orderlies. Of these numbers, we are going to translate more than 1,000 enrolled nurses into professional nurses. Now, Chair, this is something that is a serious achievement, because we have had a number of professional nurses that qualified within the system, as far back as 2011, but could never be translated into their correct category because government did not have the funds to be able to translate them. This is going to cost the department about 1.2 billion, which is money that we don't have. Currently, we did not have, but the provincial government has made sure that we are able to get access to that money. These appointments, Chairperson, are going to start being implemented from Monday, so that we are able to start the process and start hiring as soon as possible. Chair, we further call upon those who believe they have the calling to ensure that they study through colleges that are credible accredited by the South African Nursing Council and are in line with the new curriculum that has been adopted. We are saying this, Chairperson, because we've had a number of challenges previously of overstaffing that we could not absorb as the department. Chair, let me speak about the support from Cuba. South Africa has received recently 210 Cuban medical professionals to assist with the fight against COVID. Of that number, the province of KwaZulu-Natal has received 27 health professionals. We have orientated this and they have been deployed to the 11 districts in the province. We've got 3 epidemiologists, we have health technologists, 1 information management biostatistician, and we have 19 family physicians that we are sending in each and every district, with the exception of Umgungundo, Vilembe, and the Tegwini, where they will have more than 1 burden of disease. Chairperson, let me speak to issue of PPE, as is something that is very popular these days. I must indicate that right now, Assistant Azinkinga in relation to PPE, but we had the challenges, Chairperson, at the beginning, like anyone else in the world, because this is something and the world does not have enough of. But I must also indicate that over and above the PPE that we have bought, we have also received donations from Good Samaritans. Siyafisa-ke ukuthi sithi kubona makwande ngoba sizoloku sihlale njalo siqhubeka silidinga usizo lwabo. What we've also done, Chairperson, in relation to this, we've conducted an assessment of whether do we need extra doctors and allied workers, particularly where we have created additional beds. And we've realized that we do actually need those. And I must indicate, Chairperson, upfront that we don't have vacancies ngoba bakhona sebezoqhamuka bethi odokotela sibaqashe. Cha, asinawo ama-vacancies. Kodwa ngenxa yokuthi si-ede imbhede, we've decided ukuthi we want to an additional capacity, and we've requested the minister to assist us with this, and he has decided that he is going to look at our facilities as abheke noma unayo imali uyakwazi ukusinikeza yini, and if we are given that money, we'll then be able to employ as many as we can. On infrastructure development, Chair, we've indicated the different programs that the infrastructure projects that were implemented last year. But I must also indicate that we had plans this financial year yokuthi iziphi indawo esizoyisebenza, kodwa kubukeka sengathi sesizoba nenkinga nayo ukusebenza ngenxa yezimali zethu esingenazo. Sihlalo ngizocela-ke, ngiyakubona usuyangena ukuthatha emzuzwana emncane lezansi uma sengiphendula.
Qhubeka Ngqongqoshe.
Ngiyabonga Sihlalo. Pixley Isamaseme Memorial Hospital, we have worked extremely hard to ensure that progress goes off smoothly towards the completion of this brand new 2.8 billion facility. This hospital, Sihlalo, has 500 beds, and of the 500 beds, we are currently, and it's 99% complete, Chairperson. We are going to utilize 450 beds out of the 500 beds for COVID-19. I must indicate, Chair, that after COVID is idlulile, we are then going to decontaminate the hospital, decontaminate, commission kabusha, and only then will we be able to employ abantu abazosebenza Memorial Hospital full time. Okwamanje sizoyisebenzisa purely on the basis that we need the beds that are there, and into entengayo Sihlalo is that it also has a number of ICU beds that we are going to need, and sizokwazi ukuthi siqhubekise. Ngiyafisa uku-emphasize lokho Sihlalo, so that bakithi bangakhali kakhulu ukuthi abaqashiwe. On emergency medical services, in the last financial year, saying I summarize Sihlalo, in the last financial year, we bought more than 131 equipment, normal e-moto, and we're able to implement them. This financial year, we are going to continue with another about 52 ambulances that we are going to buy, and about 3 or 4 buses that we are going to buy as well for transportation of patients. Forensic pathology, Chairperson, I will request member to be able to read there. The last part is the part that is very important. On the audit improvement plan, the department once again received a qualified audit for the 2019-2020. Chair, this is a serious concern because we are very serious about good and clean governance. Audit improvement plans have been formulated and their implementation is ongoing. We are firmly of the view that proactive steps must be taken to move to, we have the firm view that proactive steps must be taken to move the department out of qualification, and that is what we are working towards. Among the steps that we are taking in this direction, Chairperson, is to make sure that we have in-year monitoring of management. There are managers that are re-workshopped on PFMA and the implementation of regulations, including in our facilities, frequent management meetings between the Department of Health and Treasury, engagement directly between the head of department and the Auditor General, so that we are able to improve our relations. In an endeavor to sustain achievement of the department from the previous audit and set ourselves on a path to achieve positive audit outcomes, we have requested the Provincial Treasury to assist with the provision of additional resources to strengthen the department's internal control component. This what we are aware that is not sufficient, but Chair, we believe it's a good start. Who assist greatly in our ongoing request to obtain an unqualified audit opinion. Chairperson, I would also at this point like once again to convey a word of gratitude to all the stakeholders, the Department of Health, and name particularly the organized labor as people that we continually work together with, and as people who are able to assist us and call us to order whenever it's necessary for us to do so. But we speak to all the other stakeholders and appreciate the work that they are doing for us and with us. I would like to thank in particular, Chairperson, all the thousands health professionals that are out there. Ikakhulukazi kulesikhathi esibhekene naso sihlalo sale nkinga ebizwa ngokuthi uCovid, ngoba ama-food soldiers ethu and ngaphandle kwabo ngeke sikwazi ukuthi siqhubeke sisebenze futhi ngeke sikwazi ukubasiza abantu bakithi. Siyabonga kakhulu. I'm also immensely grateful, Chairperson, to the departmental executive under the stewardship of the head of department, and they are with me here today. Siyabonga kakhulu ngemsebenzi enwenzayo. I wish to thank all the staff in the Department of Health, but ikakhulukazi staff from ministry for all their sleepless nights, Chairperson. Sebeze bangiceba ukuthi angibalalisi. Ngiyabonga kakhulu bafowethu ukuthi ngalali sikwazi ukuthi sisebenze sonke esenzele ukuthi impilo zabantu bakithi bakwaZulu-Natal ziqhubeke ziya phambili. Sihlalo ngiyafisa futhi ukuphinde ngibonge umndeni wami. Ngiyambonga ubaba uMagutsho Mpembe Kalokothwayo. Siyabonga kakhulu. Ngiyacela ukubonga uma wami uMavulakazi, my siblings uSithembile, uSicelo, uNokwazi, uSicele ngekho. Kodwa ke I also want to especially thank the babies, our babies. Ulwazi Lwandile, Simelane, uLethukwazi, uAbongwe, uZihlelele, Okuhle noAyanqoba. Those are the people who are very close to my heart. Chairperson, I thus present to you the 2020-2021 budget as follows. My programs, this is for program 7. My programs, administration chair, budget is 964 million rands. District health services, 23.8 billion. Emergency medical services, 1.6 billion. Provincial hospital services, 12.6 billion. Central hospital services, 5.4 billion. Health sciences and training, 1.3 billion rands. Healthcare support services, 338 million rands. Health facilities management, 1.7 billion rands. In total, budget yomnyango wezempilo is 48.05 billion rands. Siyabonga kakhulu sihlalo. Sibonga nesihlalo wekomiti nalo wonke ama-members ekomiti yakwa health kwi-province yakwaZulu-Natal. Siyabonga sihlalo.
Thank you very much, Honorable MEC. We are now going to invite the Honorable Chairperson of Health Portfolio Committee, Honorable N.R. Majola, for 10 minutes.
Thank you, Chair.
Okay, we can't see you, Honorable Chair. Can you sort out your camera, please? Thank you.
Thank you so much. Thank you, Chairperson. Honorable Chairperson, Honorable Premier, members of the executive, amakhosi asendlunkulu, elidwa ngusihlalo wawo, ubaba uChiliza. Honorable guests, ladies and gentlemen, my colleagues, honorable members of this House, I greet you all. I am honored to be presenting this committee report on behalf of the Portfolio Committee on Health. Honorable Chair, as you are aware, this is the first time in our democracy that we were faced with the challenges of global pandemic that has forced our country to embark on a necessary nationwide lockdown. This was an unprecedented event that was vital to slow the transmission of the COVID-19 virus, a virus that has put a strain on the health systems of many countries, including our very own. The KZN COVID-19 response is led by Honorable Premier and realized through the efforts of the Health Department, as well as other critical role players. The finances of the department were under stress prior to the lockdown. It will now be under additional pressure from the coronavirus pandemic. It is the hope of the committee that KwaZulu-Natal will receive additional funding through national COVID response budget that is proportionate with the need for the funding in the province. The pandemic requires the department to make immediate operational improvements in areas such as infection control, as well as the supervision and care of community members as they visit facilities. Facilities will need to ensure compliance with social distancing guidelines in order to improve safety for both community members and the dedicated healthcare workers who are assisting them. We acknowledge the physical and mental strain that our frontline healthcare workers face on a daily basis. We as the committee are aware of the issue of understaffing. We understand how it affects individual workloads and recognize that additional healthcare staff are critical. Additional staff will allow the department to continue serving the community, even when some healthcare staff fall ill or needed to be isolated. It is encouraging to hear that the department has been given permission from the Honorable Premier to employ additional staff during this time. The department will also need to double its effects in realizing the achievement of the minimum staff establishment. This will help to strengthen the department's ability to continue the fight in this ongoing crisis. COVID-19 pandemic has brought about new challenges, which we use as an opportunity to identify, interrogate, and remedy our service delivery shortfalls. This testing time in our lives can be used as an opportunity to improve our key capacities that we find are lacking and effect changes that will allow the health sector to be better prepared for the next widespread pandemic. Let us acknowledge the resilience and dedication of our healthcare staff and see this as an opportunity to improve essential workers' battle readiness before we face any health pandemic in the future. Let us take the opportunity to improve our information technology system, which support the health department. An electronic patients record system will not only allow us to improve service delivery, but also give the department a better chance of defending against the barrage of medical legal cases, which only reduce our already strained budget. As the Portfolio Committee on Health, we have taken this challenging time to further encourage communication, cooperation, and involvement with our partners in health sector unions and the private sector health institutions. We have had robust and informative engagements with these important role players. The Portfolio Committee on Health has a constitutional mandate in terms of Section 114, subsection 2B of the Republic of South Africa, read with Rule 122 of the KZN Provincial Legislature, to oversee the performance of the Department of Health and hold it accountable through various measures. It was therefore crucial for the Portfolio Committee to deliberate and scrutinize the proposed 2020-2021 budget of the department. In its deliberations, the committee needed to determine whether the department had adequately planned and made sufficient provisions for its principal objectives, and to be apprised of the service delivery outputs that were planned for the 2020-2021 financial year. The Portfolio Committee on Health undertook to hold the relevant meetings in line with this oversight mandate. The committee tables this report in accordance with the provision of the rules and orders of the KZN legislature as an account of its oversight work done for the consideration and adoption of the budget for vote 7 for the 2020-2021 financial year. Committee met with the department to deliberate on the 2021 APP and budget on the 17th of March 2020. The department provided an overview and made the relevant presentation to the portfolio committee. The provincial budget of the KZN Health Department outlines how the department intends to deploy the state's resources to implement the priorities set forth in the SONA and SOPA. The portfolio committee was informed that KZN Department of Health has been allocated 48 billion to improve the health outcomes for the citizens of KwaZulu-Natal. It was highlighted that the overall budget will grow by 6.4% on 2020-2021. The department's budget is projected to grow from 48 billion to 53 billion over the 2020-2021 MTF period. That the committee noted the following in respect of this budget: that the department will continue to prioritize primary health care and has allocated half of its annual budget towards this essential component of our community's health care. The department intends to implement an electronic patient record system in 12 of its hospitals. The committee commends the department in pursuing its goal of migrating from paper-based filing and data management to a modern and more efficient electronic system of data management, e-health. The new e-health system is being piloted at Prince Msheni Memorial Hospital as well as Madaden Hospital, as highlighted in the State of the Province address. And the committee looks forward to feedback on this important endeavor. It's noted that the department will be creating 3,500 jobs, maintaining grounds and gardens through the extended public works program. It is also the intention of the department to improve access to both professional nurses and medical officers for the citizens of KZN. The department will also be increasing the average number of daily operational ambulances in the province. Department plans to award 21 bursaries to first-year medical students and award 100 bursaries to first-year nursing students. Finally, it is noted that the department will continue its efforts to reduce HIV and AIDS and TB incidents and increase the number of clients on ARV treatment from 1.4 million to 1.7 million. The members of the portfolio committee raised concerns with respect to challenges that the provincial department is facing, namely the challenge of ongoing medical legal claims, the challenges emanating from past inefficiencies in supply chain management, and the ongoing renewal of critical service delivery contracts, which also impact the department's audit outcomes. The department must ensure that all areas of service delivery enjoy an equitable distribution of funding in line with their relevance and importance. The non-filling of the CFO post for such an extended period was also noted. How the department plans to deal with the challenges that will arise from the COVID-19 pandemic, it was also an issue. Adoption of the 2021 budget. After the committee noted the above concerns, the portfolio committee supported the budget as follows: African National Congress supported Inkatha Freedom Party, supported Economic Freedom Fighters, supported Minority Front, supported Democratic Reserved their right to support. In conclusion, Honorable Chair, the portfolio committee supports the 2021 budget and APP of the Department of Health and patiently awaits the anticipated special adjustment budget, which should incorporate the COVID-19 spending priorities, which will be tabled by the Minister of Finance. Committee supports the programs of the department as it continues to deliver and improve on the services it offers to the people of KwaZulu-Natal. The committee notes that the department's financial needs are greater than its available resources, but encourages the department to maximize what has been made available to it. As chairperson of the Portfolio Committee on Health, I would like to commend the hard work, bravery, and dedication of the MEC, Honorable SIMELANE-ZULU, and all the health officials who have been at the front lines of the fight against COVID-19 pandemic. I would also like to take this opportunity to thank MEC, HOD, Dr. Chabalala, management, and officials of the department for the cooperation during the budget process. I further extend my gratitude to members of the Portfolio Committee for their commitment to committee and constructive contribution during the budget process. Lastly, the committee thanks the support team for all the support rendered to the committee. Thank you, Chair.
Thank you very much, Honorable N.R. Majola. Honorable members, allow me again to invite the Honorable N.R. Majola. Now she will be standing in as the ANC member. She was giving us the portfolio report. Now she's coming back as a deployee of the African National Congress. Thank you. Honorable Majola.
Thank you, Chairperson. Sihlalo ohloniphekileyo wale session. Hlonitshwa uPremier of this province, Honorable Sihlezi Kalala, nesigqeba sakho siphela. Somlomo walendlu Nkosazana noNtembeko Boys. Sihlalo wosihlalo malunga ahloniphekileyo esishamthetho saKwaZulu-Natal. Ngqongqoshe womnyango umama uNomagugu SIMELANE-ZULU. Inhloko yomnyango umnumzana Sandile Chabalala. District managers kuzo zonke izifunda zaKwaZulu-Natal. Amandwendwe wethu esinawo singohoyi sithi camaka. Chairperson, I am pleased to have the privilege of participating in this budget vote of the Department of Health for 2020-2021. Members, this month of our budget is a month dedicated to our youth of South Africa. The motive behind is premised for the bravery stance they took 44 years ago, which is known as the 1976 Students' Uprising, started on the 16th of June in the streets of Soweto. This is an epoch of our history, which contributed immensely to the democracy we are enjoying today. I, as Nomakiki, I dedicate this vote to the young men and women of that generation, many of whom paid with their lives for our freedom and democracy. Chairperson, I align this youth with the new intervention the department came up with called e-health, which was initially proposed to be the digitalization on the patient filing. Chairperson, disease burden categories requires this e-health transformative approach in order to achieve Chapter 10 of the National Development Plan, which deliberates in details on the promotion of health. At this point in time, as the department, there is a high focus on ensuring the rapid increased investment in health personnel development. ANC government is overflowing of tangible, meaningful, and researched policies. Then, for all such policies that are more appropriate to the healthcare needs, these massive and focused investment in departmental personnel are one of the non-negotiable as well. Premier, please, we bow down in our knees. Issue of staffing in this department must not be blanketly graded with other departments. We talk lives that need to effect transformation of this country, specifically the province. We find it difficult in this critical period of our country faced with, because of this COVID-19 pandemic, to deliver as expected by societies. Members, as the department, we would not afford to add one person in mortality statistics because of shortage of staff. COVID-19, as guided by Communicable and Notifiable Disease Act, regulations, protocol, and procedures by its nature, it demands proper staffing norms per isolation ward for efficiency and effectiveness of health objective, as well as the compliance to the Act. No compromise needed because the very staff is not immune against this virus, meaning the need for pool of staff. Chairperson, as the committee, we took it upon our shoulders to visit all the 4 hospitals that were identified for management of COVID-19 to check their readiness for this storm. Yes, some were partly there and some relatively there, but a need for more resources, both financial and human resource, were needed. It was within a blink of an eye that first case of COVID-19 was reported, and all that we have to agree that readiness for the readiness for the pandemic of this nature wouldn't be a miracle. We must be proud, members, that despite such suffocated public health systems that we all know, compliance by healthcare workers cannot be underestimated. I am saying this because I know how stressful management of communicable disease is, and worse under the close supervision of Honorable Minister Zwelini Mkhize. Just his eyes tell you all. Chairperson, I acknowledge the audit report for the department, which is a qualified one. Yes, as the case might be, we cannot be swamped by selective amnesia. This does not need to be taken at face value, but we have to reflect back and analyze critically the model of funding used for public health facilities. Although the broad description of a national health system is important, of more significance are the detail and design of the financing system, through which varied options emerge. Chairperson, the financing of healthcare system does not depend solely on its cost projections. It is subject to many other factors, such as relative prioritization of different sectors, namely health services versus education, income support, infrastructure, job creation, consideration of level of the road accidents, patient stay in hospitals, and the level of crime which ends up in health facilities to determine their mental status in concluded their cases. They also stay in health facilities longer. National Development Plan 2030 vision is clear about the design needed for health systems. Umbono wethu wawuqinisekisa uyaqhuba wawuqinisekisa konke kuyenzeka. We have been, as the government, working hard towards the national health insurance as meaningful public partnership in the health sector. Robust debates between public and private sector partners, including civil society organizations, has been done. The process has been short-circuited by the onset of the COVID-19, which has demanded strong, coordinated, integrated health service at each center for ensuring that it is managed swiftly and effectively the unfolding curve of the pandemic. At a societal level, COVID-19 can spiral us deeper into deeper fragmentation and individualism, but can also spark a growing spirit of collective action, social solidarity, and a fresh clarity about the sustainability of our unequal society. The question is whether this moment can give impetus to building the health system we so desperately need. Yes, it has been made clear that collaboration with private sector health was long ANC position. We are currently engaging all available public, community, and private sector capacity to rapidly scale up the public health system. The National Health Insurance is slightly claiming the space. We thank the participation of private hospitals in reducing the curve of the pandemic together with our public health sector. Chairperson, collaboration with the traditional health practitioners claimed the space as a critical partner that has been put on hold for a long time at an advantage of Western medicine. Traditional Health Practitioners Act 2007 provides for national policy on traditional medicine, although there has been limited actual integration of traditional medicine into national healthcare system and structured relationship with the African pharmaceutical industry. It is important for the Department of Health, particularly its Human Resource Directorate, to develop a policy framework for how traditional medicine fits into health workforce. Premier, move forward in sending amayeza to esintu kwizindlu zengcali, that is the laboratories, to test their efficacy. We are in war as our families are dying in numbers because of this pandemic. Chairperson, arrival of Cuban doctors and specialists will reinforce the intervention strategy of family physicians who are trained on individual patient care in a well-resourced context. As I am towards closing, I am happy with how the department is presenting its indicators on maternal mortality rate. Instead of telling us the number of maternal deaths, now they are capable of telling us what has reduced it. They will put clearly that because they have put up a certain number of midwives that are trained in order to reduce that mortality rate. At least it's talking, you put your indicator next to your outcome and you tell us what is it that has caused you to get that outcome. As I close, Chairperson, let me motivate members by quoting our icon, Tata Nelson Mandela, in Madala's funeral, when he said, open quote, "In history, each individual makes his or her unique contribution, but the contribution is reshaped by the input of others to become unrecognizable on its own. Yet, some contributions stand out as monuments, precisely because the individuals responsible do not fear to differ. They don't wish at the slightest sign of divergence. Perpetua was such a personality." Close quote. ANC Chairperson, support this budget. Kangangoko sithi makaqhube ukhongolose anakekele izimpilo zabantu KwaZulu-Natal. Ngiyabonga.
Yeah.
Thank you. Thank you very much, Honorable Majola. Let's invite Honorable NJ NKWANYANA, representing the IFP, for 8 minutes.
Chairperson, let me greet you as a chairperson. Greet you as a chairperson, the Premier of KwaZulu-Natal, the leader of the opposition, Honorable VF Tabisa, honorable members. Firstly, Chairperson, allow me to say we welcome, on behalf of the IFP, we welcome the 48 billion budget allocated to the Department of Health during the 2021 financial year. It is completely unacceptable that the department budget was cut with 4.5%, below normal government, 5.5%. Equitable shares budget cuts of 285 million against compensation of employees is a huge concern since it affects critical services of the department. We welcome 467 million to address pressures in security, electricity, sewage, and water costs. However, this allocation should not affect the filling of posts such as medical officers, pathologists, nurses, administration, support cleaners, and security staff. IFP is of the view that these are crucial services that makes the provincial health facility fully operational. We are deeply concerned, Chairperson, that there is a 98 million budget cut against district hospitals as a result of prioritization of Dr. Priestley Kayisaga. This budget cut will directly leave the district hospitals with serious issues. The IFP urges the MEC of Health should liaise with Treasurer about this huge concern of budget cuts below acceptable levels. As the IFP, we are also concerned with the cutting down of important programs budget in favor of new Dr. Isaga Seme Hospital. While we agree that Dr. Priestley Isaga Seme Hospital needs to be up and functioning as soon as possible to ease up the burden from other hospitals, we are against it leaving smaller budgets for other district hospitals and other programs. Many hospitals are dysfunctional and have bigger issues that the department needs to prioritize as well. A good example, Chairperson, is the St. Francis Hospital in Mahlamatini. The ISP demands answers from the KZMEC of Health, SIMELANE-ZULU, on why the St. Francis Hospital is empty with 33 nurses looking after 6 mentally ill patients. Other psychiatric hospitals, such as Madateni and Fort Napier hospitals, are overburdened in this province. Why patients have not been transferred to these empty hospitals? Also, we want to find out why part of the hospital is not open for the public, because Nkonjeni Hospital is overloaded as we speak. There are piles of unused stock of medicine in the hospital pharmacy, which could be effectively used if the hospital is open to the public. It does not make any sense to us that a government facility would rather have no patients and equipment while the nurses get monthly payment for the government to do their jobs every day. We urge from the MEC to come clean about what is really happening about St. Francis Hospital. AG report. Looking back at the previous financial year, we can conclude that the department has been failing to use its budget accordingly. The budget allocated to the department must be fully utilized to the improvement of people's lives and nothing else. But this department has received poor audit reports for 3 consecutive years. It is high time for the KZMEC of Health to deal decisively with what has become a fashion in the Department of Health to get qualified audit reports from the AG. It doesn't make any sense to make billions of rands allocated to the Department of Health while it's failing to safeguard and use the budget accordingly. Honorable MEC, as the IFP, we want to hear from you what are going to do to ensure that the Department of Health get clean audit in this current financial year. We want to hear you representing a detailed plan with clear strategies and timeframes to ensure that the culture of getting poor audit outcomes come to an end. Irregular expenditure. The increasing irregular expenditure in this department is a huge concern to us. The irregular expenditure increased from 8.9 billion in 2017-2018 to 13 billion in 2018-2019, as stated by the Auditor General. The Auditor General further stated that he was unable to obtain sufficient appropriate evidence from communicated overtime allowances to the tune of 984 million. This is completely unacceptable. Causes of irregular expenditure, such as use of expired contracts on cleaners and security, are a cause of concern. Wasteful and fruitless expenditure. The wasteful expenditure increased from 8.9 million to 2017-2018 financial year to 9 million in 2018-2019. Honorable MEC, this tells you that there's something wrong in your department. You must stand up from the plate and ensure that all those found to be contributed to the wasteful and irregular expenditure are held accountable. Talk without action is useless. You must be tough against transgressors. These monies should be recovered, Honorable MEC. When it comes to COVID-19, I would like to take this MEC summit and applaud both the national and provincial government for spearheading some issues that need serious attention from the Honorable MEC of Health. We applaud the efforts of our government to identify hospitals where corona patients are treated. However, we are concerned that they might be not adequate to capacitate patients from all corners of this province should the demand of the out of hand. We are concerned with communities not adhering to the coronavirus pronouncements. We urge everyone to play their part in ensuring that we contain the spread of this virus. There has been an outcry for our government to increase the supply of protective gear such as masks, gloves, and sanitizers in every community agency. We are also concerned the KwaZulu-Natal Health Department has a shortfall of 6.3 billion, which it needs to fight COVID-19. We are also concerned that eThekwini and iLembe districts contribute to more than 80% of total cases provincially. Though eThekwini district has the highest number of cases, iLembe district has the highest infection rate. The IFP is concerned about the disregard for social distancing regulations amid the COVID-19 pandemic by the eMakhempini residents in Mandeni, iLembe district. When, as members of the KZN legislature, participated in the Speaker's Workers' Outreach Program in iLembe district, distributing masks and sanitizers, I was shocked when we arrived in the eMakhempini area to see overloaded taxis and vans with passengers not adhering to the social distancing rules and obligatory mask wearing. When we questioned people boarding these overloaded vehicles, their excuse was that they were rushing to work. This is totally outrageous. What is happening at eMakhempini is a recipe for disaster, and it calls for urgent intervention from the relevant authorities. We call on the KZMEC for Community Safety, Ntuli, and KZ Provincial Police Commissioner, Lieutenant General Kombinkosi Jula, to urgently intervene by deploying police in eMakhempini to enforce physical social distancing. Enforcing social distancing. Oh, Kusiyami.
Sesiphelile ngiyabonga. Bengifisa namhlanje kodwa
Ebekuseningi ngicela ngifuna ukusho kodwa.
Siphele sona siyabonga kakhulu umhlonishwa uNkwanyanana.
Manqamzeli.
Siyadlula sidlulela kolandelayo. Honorable members, let's continue and allow Honorable R. Viranna from the DA for 8 minutes.
Thank you, Chairperson. Today, during this COVID-19 pandemic, firstly, I'd just like to extend our condolences to the families who have lost loved ones during the pandemic. I also join in recognizing the true heroes in this health crisis, and that is our healthcare workers. They work tirelessly every day under immensely difficult conditions, psychological strain, and the fear of taking the virus home to their families. These healthcare workers are not just limited to doctors and nurses, but include the porters, the cleaners, laboratory technologists, allied health workers, and admin clerks, all of them who play a vital role in ensuring our health system functions. My special word of thanks goes out to Sister Ntuli and Sister Maguba, who administered the community testing in my local area, here on the KZN South Coast. Despite their own facility of Gamalake CHC having to close for decontamination, they remain committed to serving their community. But these words of support and thanks cannot just remain words alone. They must be coupled with departmental action, and this is where it is found lacking. We still have 11 paramedics at Gray's Hospital EMRS base that remain suspended. They, due to the lack of proper PPE, refused to transport a coronavirus patient, and not having that PPE was in clear violation of the Occupational Health and Safety Act. Currently, EMRS bases in KwaMashu, Clarewood, and Tongata reportedly closed due to paramedics testing positive. Yet still the contacts of these workers remain untested and the bases still await decontamination. The lack of information regarding health worker infection has resulted in numerous worker protests from Addington Hospital to Mahatma Gandhi to General Ngiza in KwaDukuza. Many of these protests were only averted when the department eventually engaged with workers and their unions. Now, the question is, why do workers have to go through such lengths just to get communication? If hashtag KZN Health cares, then it must start at home with our staff. The best way to thank our health workers is to take active steps to protect them. They deserve this and so much more. It is incredibly difficult to talk about the figures in this budget, as the COVID-19 pandemic has resulted in massive budget adjustments. This means that the figures we have are massively out of date. Instead, I'll deal with the more general principles. Even prior to the pandemic, we know that the departmental finances were massively constrained, primarily a consequence of the, I quote, 9 lost years. It continues with a qualified audit and the dubious honor of having the second highest irregular expenditure in South Africa. The major concern is still the over 20 billion rand medical legal claims that remain in the department's books, and this places the entire provincial fiscus at risk. We welcome the 138 million and then subsequent 1.3 billion in additional funds from the national fiscus to deal with the COVID-19 pandemic. However, this still falls short of the projected 6.3 billion needed. But there are steps that can be put in place immediately. Number one, appoint a permanent chief financial officer. We cannot have an acting CFO for so many years. End the month-to-month contracts in security, catering, cleaning, and medical waste services. This new medical waste contract has increased the cost to hospitals 3 to 5 times, and the security contracts have placed an additional 500 million cost onto the budget. Reinstate the Treasury task team into supply chain management, and 4, work with Treasury to benchmark the costs of commonly used items in facilities. Gone should be the days when hospitals have to pay 35 rand for a teaspoon or 22 rand for a single toilet roll. These are just entrepreneurs who want to fleece the department, and all the while patients suffer lack of services due to budget cuts. Fortunately, the coronavirus pandemic has also brought out some of the best within the Department of Health. We have seen the renovation of Clarewood Hospital into a modern, state-of-the-art infectious disease hospital, and eventually the opening of Pixley Kaseme Hospital and the upgrades of various regional and district facilities, as well as the employment of over 4,000 new nurses, albeit only on 6-month contracts. The Democratic Alliance has always indicated that state capacity does exist to deliver. So the question is, why was this not done previously? Why, according to the department's responses to the Human Rights Commission, did 530 patients have to die during the oncology crisis due to machines not being maintained? A crisis that is more dreadful than life esidimeni. Why do porters and nurses at Addington Hospital continue to be verbally abused due to the non-functional lifts at that facility, now ongoing for over 5 years? The only rational answer that we see is the lack of political will. There is a failure of political leadership that is only resolved once the eyes of the national government are upon this province. And instead of the MEC blowing the department's trumpet, she should also apologize to the KZN citizens and commit to ensure that this newfound capacity will be used to fix the other major problems in KZN Health. The MEC during this hashtag KZN Health Cares needs to focus and commit to the patients who use the Phoenix CHC or Unit 10 clinic, who have endured years of poor treatment, assault and verbal abuse from the clinic security, allegations of racism and arrogance of clinic management, that she will intervene into that clinic. Recently, clinic staff down tools for almost 10 days, resulting in chronic patients unable to collect their medication and long queues outside the clinic without any social distancing. The department put those most at risk for COVID-19 at even greater risk due to their late action. There must be accountability for what occurred at Phoenix CHC. If KZN Health cares, then it starts here. Thank you, Chairperson.
Thank you, Honorable Member. The next member is going to be Honorable J.N. CELE for 5 minutes from the African National Congress.
Ngiyabonga Sihlalo. Honorable Chairperson, ngiyabonga, Honorable Speaker, Honorable Premier of our province, honorable members. The outbreak of the coronavirus COVID-19 has been declared a public health emergency of the international concern, and the virus had spread in many countries, including our country, South Africa. On Sunday, 15, 2020, President Cyril Ramaphosa declared a national state of disaster in terms of the Disaster Management Act.
Honorable CELE, ngicela u-adjuste i-laptop yakho sizokwazi i-camera sizokwazi ukukubona. Awubonakali kuphela the upper part. Njengamanje uvelile futhi uvele kahle, kodwa ngicela uyihlele ngendlela ukuthi noma usukhuluma sikwazi ukukubona. Silibambile iwashi. Awihle. Nakoke. Yeah, ukahleke mawukanje Mhlonishwa usungaqhubeka. Ngiyabonga.
Okay. All this development necessitated all provinces to prepare themselves for the management of coronavirus. The Portfolio Committee had a great role to play, and thus from the 6th of February 2020, the chairperson of the Portfolio Committee on Health initiated the oversight program and also a robust engagement with relevant stakeholders. On the 6th of February, we visited Manguza Hospital to do oversight. The Portfolio Committee found that they were ready, but the issue of beds was a great concern since the hospital had 6 beds. We also visited NKWANYANA Hospital, Eddington, and the Grace Hospital. The aim of the Portfolio Committee was to ensure that all health facilities are in order, especially those hospitals that were designated to handle the cases of coronavirus are ready. Thanks to the department chairperson, because all the resolution that we discussed, they implemented them. The Portfolio Committee convened a meeting with the CEOs of private hospitals. That was after the attack of coronavirus from St. Augustine to engage on the issue of preventing the spread of this virus, and later we engaged the unions. Matters of occupational health and safety were key management of the virus, human resources, infrastructure, tools, equipment, and ultimately the treatment was a paramount to manage the emergency deadly virus. Udaba lwama-PPE ngeze lasala ngaphandle ngoba kwakuyilona daba olwaludla kakhulu umzi. Siyabonga ukuthi i-department sibonga uPremier wethu owakwazi ukuthi angenelele kulolu daba ukuze udaba lama PPE lu-addresseke njengamanje elikwazi ukuthi njengamanje umsindo ungekho kakhulu ngokungenelela kwe-department. Ngiyabonga kakhulu speaker kulolu daba, but before ngiqede chairperson ngifisa ukuquota ingqalabutho yethu baba uMandela uma ekhuluma ngezinto zempilo ekhuluma nangabantwana, then there can be no keener revelations of society soul than the way in which it treats its children moving forward. With a vision for 2030, the National Development Plan has a focus on healthcare and health issues. I thank you, Chairperson.
Thank you.
Yeah,
Thank
yeah,
you very much,
Joyce.
Honorable Kele. The next speaker is Honorable LG SEJA from the EFF for 9 minutes.
No, thank you, Honorable Chairperson. Greetings to all honorable members and the staff that is here in this debate. The EFF notes with great dismay the fallacy and myopic success story that has been told about KZN health. COVID-19 stands not just as a virus that has put a strain on our health system, but has harshly exposed not only the unreadiness of the...
Mhlonishwa SEJA.
Hello?
Sesibona ikhanda nje kuphela. Can you adjust your camera?
That's myself. Can you see me now?
Now mkhulu kakhulu SEJA.
Hello?
Better, honorable member.
All right, no, thank you, Honorable Chairperson. No, NSC, Honorable and SIMELANE-ZULU, and all the health officials who have been at the front lines of the fight against the COVID-19 pandemic must account for the growing concern of the increasing rate of infection among health workers in KwaZulu-Natal. Health documents more than 110 medical staff at 6 private and 3 public hospitals have tested positive for COVID-19. 3 Netcare hospitals have been affected. St. Augustine's in Durban was closed at the beginning of April when 48 health workers tested positive for COVID-19. A total of 10 staff members at Kingsway in Amanzimtoti have contracted the disease, and the hospital has been closed since mid-April. As well as Parkland in Durban, health workers have also tested positive at other private hospitals, such as the new Shifa in Durban, Hibiscus in Port Shepstone, and Eden Gardens in Pietermaritzburg. Employees at 2 state hospitals in Durban, Eddington and Albert II, have also been infected. Most recently, 16 people, including 2 babies, as well as doctors and nurses, tested positive for COVID-19. At the General Justice Kizange Mpanza Memorial Hospital, indicative of a serious cross-infection problem in KwaZulu-Natal, and all these officials must account. Nurses and other essential workers are mightily at risk, and a failure to address colossal failures to mitigate and manage the spread of the virus must not be modulated or muzzled by the celebration of the few media appearances by the NSC. As the province with the 4th highest number of reported cases in COVID-19, as a province that is the epicenter of the HIV and tuberculosis co-epidemic in South Africa, with one of the largest burdens of MDR incidence and prevalence of multi-drug resistant tuberculosis in the country, and amongst the highest in the world, we are found one day failing to even instinctively observe near global trends of the pandemic and respective health department responses in those countries who have battled with the disease longer than us. Regardless of universal warning months before, the department has been complacent in the shortage of personal protective equipment, risking the lives of public healthcare workers who deserve the same protection as their counterparts in the private sector. Simple put, health workers in KZN who serve the poor in risk, who serve the poor were not being provided with personal protective equipment for dealing with COVID-19 and were still expected to treat patients with these prevailing conditions. Such striking ignorance, recklessness, and navel cannot be afforded by the province, confronted by over 1.4 million people living with HIV and TB, respectively. People living with HIV with advanced disease, those with low CD4 and high viral load, and those who are not taking antiretroviral treatment have an increased risk of infections and related complications in general. Until it is known if the immunosuppression of HIV will put a person at greater risk for COVID-19, additional precautions for all people with advanced HIV or poorly controlled HIV should be employed. We have not seen any of this happen of being tabled because of incumbent people deployed by the ruling party to run health. Reducing the mingling between infected and uninfected people through a lockdown has been effective. However, testing and isolation is a key component of the overall lockdown strategy. We have seen very little progress as far as testing is concerned in KZN and have grown even more worried with the Premier's premature declaration of KZN being ready for level 3. We must never waste a crisis and use it to reflect on those entrusted to govern and the system in which people are expected to live. The department does not improve institutional capacity in hospitals and clinics, has not invested in equipment, in elementary things like educating people about the virus and addressing the cross-infection occurring currently, but it is counted amongst those who claim we are ready for first aid. Clearly, there is monumental crisis of leadership in the department concerned with the livelihood. Hello? I was talking, Chair. Oh, we are ready. It's a monumental crisis of leadership in the department and its very officials. A loud reminder that the FF is the only organization fit for governance and concerned with the livelihood of people, still explicitly rejecting the downgrading of the lockdown and the reckless exposure of essential service workers. It is a grave manipulation of truth that the department has met any of the performance targets. This evaluation is untrue and is merely a cheap attempt to shift our attention from the only target of the department. The department has not met any performance targets in their programs or sub-programs as set by the Premier, and there is nothing to celebrate. Only targets of corruption and the lack of intentionality in addressing corruption have been met. Nevertheless, reduced to toothless watchdog, the Portfolio Committee on the Health still has a constitutional mandate to oversee the performance of the Department of Health and to hold it accountable. There has been a notable colossal failure in this because corruption is the sector. In this sector, it is not a series of remote action by random people, but a very intentional tender fraud plot by the very people who are supposed to ensure financial accountability within the province's health sector. Just recently, charges related to the procurement of 4 mobile hospital units for the province constituted irregular, fruitless and wasteful expenditure as per Public Protector's report, which translated tender fraud to the tune of 61 million rands, dating back to the former MEC Health, Dr. S. Dlomo, the minister led for 10 years. How much corruption, abuse of power, and theft is undocumented. Very recently, 6 health officials from various hospitals in KwaZulu-Natal have been arrested for fraud, corruption, and money laundering. The arrests form part of a long investigation into 12 hospitals in the province. Again, dozens of health officials were paid bribes by 3 companies who secured contracts of more than 9 million rands over several years. These officials have names belonging to a common organization and are deployed not for the betterment of the people, but are there for one purpose and one purpose only: to steal. We must really reflect on the character of the Department of Health and test if it has a good story to tell, a story of fraud, supply chain manipulation, and an inability to steal hold institutions like KZN to account for sale of space in its medical departments even 3 years later. The ANC is a danger to itself. And we welcome KZN Department of Health has been allocated for 8 billion to improve the health outcomes for the citizens of KwaZulu-Natal. Growing the budget by 6.4% in 2020-2021, that is from 48 billion to 53 billion to, amongst other things, prioritize primary health care, facilitate the introduction of health system, and to reduce HIV and TB incidents, commendable and in line with our call for free healthcare.
Sona iskati, honorable member, siyabonga kakhulu. Thank you.
Yeah, thank you.
The next speaker, honorable members, is supposed to be Honorable MLOTSHWA, who opted to attend to the other vote. So we therefore pass to the next honorable member from the African National Congress for 8 minutes, Umhlonishwa NPF MAVUSO.
Thank you very much, Honorable Chairperson, Honorable Chair, Honorable Premier, and the entire Executive Council, honorable members, ladies and gentlemen. Honorable Chairperson, we want to indicate as the African National Congress that we all have a revolutionary duty, particularly during this time of COVID-19, to ensure that our people adhere to the regulations. We can't be the first to point fingers that people are not ensuring social distancing and the other regulations that are attached to the pandemic. We also are happy as the African National Congress that Honorable SEJA is indicating that the officials that were found to be arrested have been arrested, and it shows that the ANC is indeed against corruption. Honorable Chairperson, the ANC lifts the South African flag in respect of the healthcare workers who are in further send our deepest condolences to all the families who have lost their loved ones due to this pandemic. Coronavirus disease is rapidly spreading worldwide. Globally, as of the 3rd of June 2020, there were 6,287,000 confirmed cases and 379,949,000 reported deaths to the World Health Organization. The rapidly evolving epidemic has stressed the entire healthcare system of many countries in the world. Our country as well has been hard hit by this pandemic. In KZN or KwaZulu-Natal alone, Honorable Chair, as we speak, 2,869 confirmed cases, and there are 1,260 recoveries and 55 related deaths. In the early stages of the outbreak, Honorable Chairperson, of the coronavirus disease in South Africa, our healthcare system was already overwhelmed with shortages of healthcare personnel. This epidemic called for practical actions to reorganize and safely maintain access to high-quality healthcare services. The department had to make amends with the fact that time has changed and the issue of minimum staff establishment had to be revised, considering the constraints resources it had, especially with the budget cuts. However, COVID-19 made a call to all of us to change the norm and accept that it is business unusual. In times of crisis, Madam Chair, the department was called to assess and contribute to a broader response of the societal impact with a focus on the well-being of the staff, the stakeholders, and the community. They needed strategies for service continuation, strategies that would ensure that the service provided to our people was of optimum standard. At the helm of this was the role of the Portfolio Committee on Health to exercise its oversight role over the department.
This was not an easy task, noting the budget challenges that were already faced by the department, but the portfolio committee had to soldier on and lives had to be saved. The portfolio committee, Honorable Chairperson, emphasized that human resource from any level in the department in terms of healthcare sector had a critical role to play. The management of each healthcare facility had to deliver accurate, assertive, clear, and consistent communication to all levels of staff. Their approach was expected to come from a place of empathy and understanding. Staff are our most valuable asset during this time. In our recommendations as the Portfolio Committee and resolutions, key emphasis was placed on continuous training and development of staff as the disease was also developing. Regular and intensive training for all healthcare providers was necessary to promote preparedness and efficacy in crisis management. Honorable Chairperson, honorable members, the Portfolio Committee foreseen that frontline healthcare providers treating patients with COVID-19 have greater risks of mental health problems, such as anxiety, depression, insomnia, and stress. Hence, the call for support and training. Adjusting to an entirely new working environment in this stressful situation called for psychological support and conducive environment to work on. We were one step ahead. In light of adhering to minimum staff establishment, the department has responded by the decision to create posts for a period of 6 months in various categories of health professionals so that all quarantine and isolation wards and new facilities are resourced with appropriate staff. As the MEC, Honorable Chairperson, indicated in a speech on the opening of the new facility at Clarewood Hospital on the 2nd of June 2020, that in one of the department's biggest and most significant HR recruitment drives ever, the department had, as of that week, advertised 4,773 posts in the following categories. That is your professional nurses at 2,408, 1,968 enrolled nurses, 230 general orderlies, 70 ward clerks, and 97 ICU nurses. We therefore, Honorable Chairperson, pride ourselves as the African National Congress on the initiative as it addresses primarily the unemployment, as it is one of the triple challenges that has engulfed our country. We further believe that these employees will continue working and be permanently employed as the department and the province would have invested a lot in them in terms of executing their duties. This comprehensive support for frontline healthcare included but not limited to provision of sufficient personal protective equipment, reasonable work schedules, effective communication, monitoring and supervision of infection control, and professional psychological support. Matters relating to occupational health and safety standards were of paramount importance so as to ensure that reduced the risk infection from COVID-19. Healthcare workers in quarantine...
Conclude, the honorable member. Conclude.
Thank you very much, Chairperson. Chairperson, we welcome also the Cuban doctors that have come to assist. In closing, Honorable Chair, we want to indicate as the African National Congress that we support the budget of the Department of Health, and we also indicate that the lives of our people are in the safe hands. I thank you very much, Chair.
Thank you very much, Honorable Member Mavuso. Honorable members, the member to come in now is Honorable Raj, but let me inform the honorable members that Honorable THAKUR Rajbans together with Honorable PHAKATHI have applied for Rule 73, which states that a member can take the minutes of the member who is not in. Therefore, The Honorable THAKUR RAJBANSI is going to take the 3 minutes for Honorable M.E. PHAKATHI. Thank you, Honorable Raj. You may proceed.
Thank you, Honorable Chair. The Minority Front takes this opportunity to thank the Honorable MEC, officials and all healthcare workers in the private and public sectors for their dedication towards saving lives during this pandemic. Similarly, we thank our hardworking chairperson, Honorable MAJOLA. We are not out of the woods yet, Honorable members. So from lessons learned, thus, the Minority Front recommends the following. Health epidemiologists must carefully study how the coronavirus spreads in our communities in order to continuously update SOPs and guidelines to prevent its spread, as prevention is best since there's no cure yet. Continuous training for healthcare workers on the 2020 version 4 of the clinical management of suspected or confirmed COVID-19 disease, networking with socially responsible businesses who can step forward to help in this fight against coronavirus, including community pharmacists to promote awareness in terms of coronavirus public health initiatives and strengthening public-private partnerships. The MF thanks private hospital groups that offered free assistance to the Department of Health in terms of facilities and equipment use. I also thank some private hospitals for their consistent CSI initiatives over the years, working with vulnerable groups. The one thing I can vouch as a former private sector healthcare professional myself is that we understand as recipients that we can't always be takers, but we have to be givers. It's our obligation. COVID-19 definitely has had an impact on all health sectors, but as Ahmed Bandeka had stated, one should never let a crisis go to waste. Hence, a pandemic will be an acid test for the NHI. We must all acknowledge, honourable members, that COVID-19 will reshape triple Ps. Whether these are short-term reactive triple P projects and partnerships for a year like we're currently experiencing, or medium-term 1 to 5 year proactive arrangements, or long-term future-proofed projects and partnerships beyond 5 years. Honourable MEC, you have a legal mind. Therefore, the key considerations moving forward should be contractual provisions in preparing for post-crisis conditions. If there was a time for look like a hospital, it is now. Hence, SOPs guiding patient and healthcare workers' safety is critical. Finally, the Department of Health needs to partner with the technology sector for the latest digital tools. Time is vital, but we must create a newly reimagined future together. The Minority Front supports both 7 budget of 48.05 billion with the expectation of increased adjustments as we go forward. Thank you. Chair, can I carry on with Honorable PHAKATHI's speech?
Yes, yes, Honorable Member.
Okay.
It has been included.
Right. Okay. On behalf of Honorable PHAKATHI from the ATM, greetings, Honorable MEC and guests. We take this opportunity to thank all hardworking officials and healthcare workers for their selfless service. Honorable MEC, the ATM is very concerned about the state of our mortuaries. We know that coronavirus can spread even from a corpse. Currently, I'm attending a funeral, and therefore I have these concerns. Is the compliance of SOPs being monitored in mortuaries? More has to be done to protect our staff. The budget must incorporate upgrading mortuaries to bring changing health, to meet the changing health crises, to prevent infection spread. The department is applauded in targeting the reproductive health of our youth. Such budget spend is needed to curb unwanted pregnancies and the associated social and health dangers. I foresee the need now to plan seriously for step-down facilities and temporary health structures that can start accommodating key health partners, whether it's the smaller private pathology labs or PPE providers. We must identify various available ground space, for example, at Grays and other spaces in KZN2 for isolation purposes. Honorable MEC, let's be proactive with the use of ground space in our institutions to leverage for NGOs, volunteers, mothers' lodges, or healthcare workers' rest spaces. To our private sector guests, I want to say that this pandemic needs solutions that are not only economic in nature, but also moral and humanely focused on our vulnerable citizens at large. So please come on board and propose areas where you can assist as business, where you can assist the Department of Health. The ATM supports the Vote 7 budget with these recommendations. Thank you.
Thank you very much, Honorable RAJBANSI. Honorable members, we have received an apology from Honorable MANQELE. We therefore move forward. Let me invite the Honorable E.V. DUBE on behalf of the ANC for 8 minutes.
Thank you very much, Chair of the session. I do want also to take this opportunity and greet the MEC together with the staff and the HOD. Ngiyabulisa kakhulu kuKhuzeni, the Premier of our province, and the members of the executive. I just want to start here by the words that were proclaimed by Marcus Garvey. Let me quote, "There is nothing more dangerous than to build a society with a large segment of people in that society who feel that they have no stake in it, who feel that they have nothing to lose. People who have a stake in their society want to protect that society, but when they don't have it, they unconsciously want to destroy it." I close quotes. It's very interesting that I listened to Honorable SEJA, who I don't think he has ever attended the meetings of the health portfolio, and he says it is difficult or you will never know the character of the ANC. Truly, you will never know the character of the ANC because you are not supposed to know the character. You are supposed to follow what the ANC says. You must not be part of those society who live in the society that they want to destroy. And everything that you say here, it's negative, negative, negative. You will never see a positive because you don't sit in these meetings. That is, first of all, you know, your organization should remove you, and they must consider that, because a person who does not sit in the meetings and is given an opportunity to debate will blunder, as you say. I think a lot of things have been said by the MEC here that you were supposed to listen. But let me leave that because maybe some people will answer it. But the last point that I want to mention from what you say is a point where the department has arrested people. And again, you still have a problem when the department itself not being commanded by you. They've done it themselves and they found a reason to arrest the people, but you still have a problem with that. Indeed, you will never know the character of the ANC. In a document, when ANC was preparing the health policy before 1994, these were some of the words that were said. The challenge is to design a comprehensive program to redress social and economic injustices, to eradicate poverty, to reduce waste, to increase efficiency, and to promote greater control by the communities and individuals over all aspects of their life. All legislation, organization, and institutions related to health have to be reviewed with a view of attaining many, but two of the following that I'm going to cite here. One was to ensure, or is to ensure that the emphasis is on health, not on medical care. Secondly, recognizing that the most important component of the health system is the community, and ensure that mechanisms are created for effective community participation and involvement and control. I do want to say fully, I see us as a Department of Health achieving or fulfilling what the ANC has laid as a background for us to operate njengenhlangano ebusayo njengamanje. But I do want also to thank the Department of Health under the leadership of Comrade SIMELANE-ZULU for showing a brave attitude and taking a call of COVID-19 ahead, something that has never been on the plans of the department at all. Sibonga ubuholi bukaNdunankulu Khuzeni osabele ngokushesha kuleli khwelo walungiselela isimo ebesingasilindele wonke umuntu engasilindele ngesikhathi nje esifishane kunezinto esizikhulumayo ezibonisa ukuthi kukhona esikwenzayo njengenhlangano ebusayo ukuhlangabezana nesimo se-COVID-19. Kuvele kwacaca ukuthi isikhathi esinjengalesi abaholi bavele basukuma benza obekufanele bakwenze baphuma ema-ofisi njengoba sibonile bekwenza nsuku zonke. I cannot obviously forget our health workers who are waking up in the morning to face the enemy that they cannot identify. Sonke sitha esisabayo esenze sahlala emakhaya. Once must salute also those people who have succumbed, to COVID-19 and pass condolence to their families for their loss. Let me also pass a very special word of condolence to the family of a lady that I've known for years who left Durban 6 months ago and went for retirement Eastern Cape. UMAVUSO besimazi ngokuthi uMamuskhosi. She has been a member of our church more than 12 years, but she decided to retire and go home 6 months ago. What happened is that she was a sickly person, and then she was admitted in the hospital. Unfortunately, she contracted COVID-19, and the daughter-in-law who was assisting her on the last days of her life also was in a situation la ethathwe khona i-COVID-19. Umngcwabo wabo was shown on CNA on Monday. May their soul rest in peace. Why do I cite this, Honorable Chair? It is to show us, to make understand that COVID-19 is not far as we may think it is. The truth
Honorable
is,
Member, can you conclude?
The truth is, as Mandela has said, there are 4 basic and primary things to which most of the people wishes to live. We wish to live in the safe environment, to be able to work, to provide ourselves, and also provide our children, and have a good public health. These are the basics that we have created our foundations on as ANC. I do want to once more thank the MEC, thank the team for bringing hope. All of us, we are looking for a solution. At the moment, we do hope that when we wash our hands, we'll be safe. We hope that when we wear masks, we'll be safe. We hope that when we sanitize, we'll be safe. We hope that if you stay at home, we'll be safe. And we hope that we'll end up going to work and we will be safe. We as the committee cannot stop thanking and applaud uhlalo wethu ngokuthi asihlanganise sikwazi ukukhuluma nezinyunyana sibe nesikhathi nazo sixoxisane nalesimo akade bebhekene naso. But I do want to say ukuthi MEC wethu has said it mournfully, the opportunity evulwe i-COVID-19. At the moment, we are going to see regional hospitals being built. We are going to see e-filing system. We are going to see 4 regional hospitals. We are going to see mobile APP coming up. Siyabonga kakhulu thina njenge-African National Congress siyayisupporta kakhulu le budget. Siyabonga kakhulu. Thank you.
Siyabonga mhlonishwa uDube. Bahlonishwa, ngicela ningivumele nginikeze leli thuba kumhlonishwa uR Viranna imzuzu emine 4 minutes uqhamuka kwi-DA.
Thank you, Chairperson. Now, the province has always said that its processes are based on science and scientific research. So let me quote the research that was actually published today by Prof. Karen Runciman from the University of Johannesburg Center for Social Change, and was done in conjunction with the Human Sciences Research Council. And this research has shown that when more information is shared with the public, they are more likely to comply with social distancing and mask wearing regulations. Now, we have all seen the numerous videos and photos of violations to regulations that are happening at the moment. Yet the Premier and the MEC have still consistently mentioned that they will not release the daily district and municipality-specific case information that is needed to inform members of the public of the threat of and spread of disease in their areas. The Western Cape, the Gauteng, and the Eastern Cape are already doing so. It is a complete fallacy that the release of this anonymized municipal case numbers will result in increased stigmatization. This is known from extensive research in KwaZulu-Natal itself, and this research was done by the University of KwaZulu-Natal during the AIDS pandemic and the massive stigmatization we see during that pandemic. Rather, we know that extensive information sharing prevents the stigma. So again, we place the call on the MEC and the Premier to release these figures so that the people of KwaZulu-Natal know what is happening. As the DA, we're very concerned with the rising arrogance and disrespect of the KwaZulu-Natal health MECs. We're concerned that it took over 6 weeks for her to present to the Health Portfolio Committee the detailed COVID-19 plan for KwaZulu-Natal. And then only when the frustrations of the committee members reached boiling point. Unfortunately, it seems that the MEC is continuing her acts of a predecessor, which is Dr. S. Lomo, which includes the denial of access of opposition MPLs to do hospital oversights. As the Democratic Alliance, we take no pleasure in the reports that Dr. Lomo had to face his own medicine when he was denied access to oversight visits at St. Mary's Hospital in Mthatha in the Eastern Cape. But what we do hope is that this will lead to a change in attitude from MEC SIMELANE-ZULU, that opposition MPLs will be allowed to fulfill their constitutional
Honorable
duty.
Villan. 56 seconds left.
That they will fulfill their constitutional oversight duties as set out in Section 114 and 115 of the South African Constitution. We demand this change. What's happening? Chair, do I have protection?
Order, Madam Chair.
Honorable members, honorable members, there are members who are disturbing Honorable Viran with his 30 seconds. Can we allow him to finish? 30 seconds. Thank you.
Madam Chair, we continue with the call that says that as South Africans, it is in our hands to ensure that the spread of the COVID-19 pandemic is stopped. We encourage all South KZN citizens to continue to wash their hands, to continue to place their trust in the medical scientists and epidemiologists that are working to keep South Africans safe. I thank you, Chair.
Thank you very much, Honorable Viran. Members, can we ensure that we keep our mics and our cameras on mute? Let us not disturb members. Thank you very much. Can we now proceed to our next honorable member who is going to represent the IFP for 7 minutes, Honorable T.J. Gumede.
Batata. Yeah. Batata.
Thank you, Chair, for the opportunity of giving me. And I greet you. I greet my IFP leadership, all protocol observed. IFP comments moving of 408 million of goods and services program to security upgrade. Upgrading in the KZN hospitals, it's dying. To combat the killings that happen within their prisons and theft that go by unabated. Just recently, 2 health workers were caught with millions worth of HIV treatment. IFP hopes that the security plan will include inter alia incidences where emergency services staff get abused and robbed on their belongings when responding to the public calls. So one cannot overemphasize the seriousness of the security. But let me come to this COVID-19 pandemic. With all its woes, it has taught us one thing and one thing only: to be proactive. No knee-jerk responses. That should be the thing of the past. And also we must know that with all the beds, with all the money, with everything that can be allocated to the health, COVID-19 will never stop until we go down to the basics. There is competition between economy and the pandemic. In any competitive situation, there's only one winner. The loser here will be the lives of the people. We are now seeing the surge of people are moving around. It is a fact that 80% of the infected are asymptomatic, yet capable of transmitting the virus. It is equally true that the majority of the citizens are non-compliant, yet don't wear masks. If they do that incorrectly. Honorable Dube, we're not saying people must be not arrested or they should be arrested. But the IFP is of the opinion that with what the MEC have said in the extensive education campaigns, we must include all the necessary information in those campaigns. For instance, to beg the people to be where we are. I'll give you an example. If I say to my child, don't always wear a mask when you are at the public space and whatever, but if I don't tell him or her that it's because the virus can be suspended within the space for more than 30 minutes, I've not told her anything. So we need to dissect and go down to the basics of the condition. There are vulnerable groups who are sitting ducks for the fatal COVID-19. Amongst those are senior citizens who are psychologically traumatized. Every time you open the TV, the president tells that 60 and above, we are going to die. You open the radio, 60 and above, we are going to die, but nothing is being done about it. So we request MEC, start giving all the senior citizens flu vaccine to mitigate the impact of the infection. Give them vitamin E's in your hospitals and clinics. Vitamin D is free. We just sit outside the sun and get vitamin D. And I didn't hear much about the shortage of test kits. Because in Western Cape, as it is experiencing a high number of this infection, but they don't have test kits, and they've engaged with the department, with Dr. Zweli Mkhize, but the test kits are still being ordered, coming from somewhere overseas, I don't know where. Also, while dealing with this COVID-19 thing, please consider in your budget to look at the turnaround time for test results. It is not acceptable that the results can come after 14 days when people are already gone through the period of infection. All the reasons above mentioned are, I've said already that the existing problems of the department will be exacerbated if not taken care of. During the last week of May, the committee was privileged to be invited by the National Health Portfolio Committee Chair, Honorable Sibongiseni Dlomo. In those visits, we were not oversighting, but he was seeking valuable information. We visited Gizanga, St. Augustine's, Grace, and Clarewood hospitals. Each hospital and each institution has got its narrative. So in this COVID thing, everybody writes his or her story, and MEC, you'll have to write yours. I also plead with the MEC to form, I don't know what to call this, but all the institutions and all the leaders to have a common place where you can share the information, because that information is overwhelming. Extensive educational campaigns we have mentioned. As I said, they must be detailed. But while cities looking for burial spaces, the department must also look for mortuary spaces, because we are going to go back to that Gale Street thing of corpses on top of another. In conclusion,
Nhlonishwa, sengisaba ngisho ukuthi sekuphele sona isikhathi.
Singaphela kanjani ungangijanga ungonisha?
Hayi,
Ngoba abantu batshela sekusele 1 minute.
Siphelile ngane yakwethu. Thank you very much, honorable member. Allow me to invite the member from the African National Congress, Umhlonishwa, SIBIYA, for 11 minutes. Honorable Sotobe.
Thank you very much, Honorable Chairperson. Greetings to you, Chairperson, the members of the legislature, the Premier and the Executive, the MEC in particular of the Department of Health, and the people of this province. Honorable Chairperson, it becomes very difficult, to debate in such an environment, very poisonous environment, where instead of people who are part of the debate, they contribute meaningfully in shaping the policy, but also the agenda of this province when it comes to the health system. But instead, they just go out of the direction. They don't help the people who voted for them. They just become useless, literally useless in the debate. It's like it's a debate that is going nowhere slowly. And sadly, the ANC will always expect that opposition parties, when they debate, they will bring in something positive and meaningful, even if they criticize, but they must come with solutions. But sadly, it just becomes a waste of time, honestly speaking. The ANC doesn't have an opposition in this province, just have parties that are not prepared to do their work. And I plead with our opposition parties, please do your work, focus on the work that your members who voted for you, voted you for. But nonetheless, Chairperson, we'll have to clarify some few things here, because we are the governing party of the ANC, and we'll help them to understand things better. Honorable Chairperson, it's just very important that we remind the people of this province that in KwaZulu-Natal, we are coming from a province that literally didn't have infrastructure, health infrastructure, when it comes to areas where Black people are located, in particular in the deep rural areas. Chairperson, if I can tell you, today it's amazing to see ambulances going in and out of where I'm residing, picking up our sick people and vulnerable people, helping them. When I was growing up until 1994, I never saw a single ambulance coming to where I reside, not a single ambulance. And I believe many of the members who are seated there in the opposition parties who are today debating and telling us that ANC is not doing anything and this department is not doing anything, they easily forget such things. We never had hospitals with infrastructure. If you talk about the hospital, you talk about NKWANYANA Hospital, St. Benedictine Hospital, all those hospitals, it was just houses with no infrastructure, with no equipment that is used for health purposes. But today, when you go to those hospitals, it's a different kind of a situation. They are way different from what they used to be, but they easily forget that. And that's where some of them grew up in those rural areas. I don't want to talk about some who have just came in now and don't know how things were happening before. We used to have a situation, Honorable Chair, where when you talk about the clinic in this province, it was something, myself, I never saw a clinic up until 1998, if I'm not mistaken. The clinic that was built after 1994, there was none of clinics in our rural areas, literally none. And today, go to all wards, go to rural areas and see the infrastructure that has been put in place on the ground, tangible, that you can see. And those clinics are functioning, are helping our people. They easily forget all that. But let me come to some of the few things that have been said. Honorable Chairperson, the Department of Health has done quite a sterling job under Honorable MEC SIMELANE-ZULU, and we are very proud of the work that is being done by the department. We must say that there is quite a lot of work that still needs to be done. Health issues can never be finished and completed. They are a moving target because each and every time you must introduce new things. And this department is exactly doing that. They have built a new state-of-the-art hospital that one member is complaining that it's being prioritized for no reason. Peasley Hospital, it's a strategic hospital. It's a mega project that has been undertaken by the Department of Health internally for the first time, worth about 2.3 billion rand, with 500 beds, with the state-of-the-art machinery that you'll find inside that hospital, with a green energy that is being used in that hospital. It meets all the standards that we need. But the most important thing, Chair, why it's being prioritized, is because it's located in a very strategic area where our people are concentrated, coming from all over the province of KwaZulu-Natal, even outside KwaZulu-Natal, in the area of the HMC.
Honorable Member Sotobe.
Yes, there is an echo, Honorable Chair.
Yes, honorable members, can we please close? Please, honorable members, continue. Swabambila minute, you may continue now.
Thank you, Chair. But I'm saying that that hospital is located in the Inc. area where the majority of our people are located, coming from all the corners of this province, coming from the outside this province, who came to work in eThekwini, but also who are residents of eThekwini. We've got quite a number of them, millions of them are staying in the northern part of eThekwini. It's going to help this province, not only in eThekwini, because most of the people who you find there, majority of them are not only the residents of eThekwini, but are coming outside the province of KwaZulu-Natal. So you can't compare it with any other hospital that can be built in any area. It's going to ease the burden for this province in the eThekwini region, which we know it's the biggest region, and most of our health issues come from that region. So it's a strategic hospital. You need to think when you think about how to locate hospitals. It will only take thinkers to understand that. But also, Chairperson, the issue of corruption, I think it's been dealt with quite, it's a tired issue now. The ANC is the department which is led by the MEC is very clear when it comes to corruption, it's very clear when it comes to underperformance. No worker will be tolerated who's underperforming. No worker or any politician will be tolerated who's involved in corruption. Honorable SIMELANE-ZULU, the MEC, knows it very well, and he understands what needs to be done there. So we can't continue raise. That's why I'm saying I wish members can be able to raise issues that are going to help our people. The issue of observation of regulations of the COVID-19 remains the task of everyone in this province. It remains the task of each and every member who's in the legislature of KwaZulu-Natal. We can't always point fingers, Honorable Chairperson. What is our responsibility where we are coming from? What is our responsibility in our constituencies? It's not going to be the department's work to go and tell people all the time, wear your mask, wash your hands. That message is out there, but we need as leaders to play our effective role and stop blaming and pointing fingers. Honorable VIRANNA, oh my God. You know, Chairperson, it's important that people learn also how to pronounce these names. it's General Kizenga Mbanza, not what Honorable Viranna pronounced. It's important. I know he's fluent in English, but he's in South Africa, in KwaZulu-Natal. He must be able to reflect who we are here. We know that the DA don't understand the workers' rights. He complained about workers demonstrating regarding some of the issues they had with the department. The workers' rights that, in fact, the workers' rights that we see today, whether it's any right that you'll find in the Constitution, it's coming from the very same ANC. It's the ANC who gave these workers the right to demonstrate and exercise their democratic rights. We don't frown at workers when they demonstrate, but the DA will always frown. That's why one of their members yesterday, in fact, insulted unions and called them thugs. So we are fine with workers complaining.
Again, honorable members, Honorable Sotobe is having challenges. Honorable Sotobe, we can't hear you.
You can't hear me, Chair.
Now we can. Thank you. We will do the same with time.
Thank you, Chair. Honorable Viranna went further again, talking about a 100-year-old story which doesn't exist, which is just pure nonsense, talking about 9 wasted years. Let me remind Honorable Viranna what this province has done in the past 9 years. In this province, we have built...
Order, Chairperson.
We have built... Chairperson.
Order, Chairperson.
Honorable Rogers, what rules?
Thank you, Chairperson. I just wanted to remind you of the virtual rules and, in fact, the protocols of engagement, that only the speaker is supposed to have their camera on. I know the MEC is looking very glamorous today, but I don't think she should have her camera on.
Thank you, Honorable Rogers. Thank you. Honorable Sotobe.
Yes, very beautiful. Video as well, Rogers.
MEC, please.
Rogers must switch off his own video as well.
He was on here is the point of order.
You can't see me.
Order, honorable members. Order, honorable members. Uzawucisha umhlonishwa. Thank you.
Thank you, Premier. We are happy you are here. Chairperson, is talking about the 9 wasted years, a story that is tired, a story that is manufactured, a story that doesn't exist. It's just pure nonsense coming from a member who lives in this province and living in this country, who can't tell what has been done in the 9 years that you are coming from. Let me remind them what has been done in the past 9 years. We have built quite a number of clinics. In fact, these clinics have been built in rural areas to benefit our previously disadvantaged people. That's why I believe they will say nothing has been done, because these things are being built where our people need them most. They wish we can use a system that is used in Western Cape, where development is only being done in affluent areas. And in this province, it's not going to be done because ANC is in charge. So that's why we've built CHCs. We never had CHCs in this province. It's a new concept by the ANC, and it's working. We have managed to make sure that our hospitals are being improved, those that were in existence. We've built new hospitals as well. We have improved the life expectancy of the people.
We can't hear Honorable John.
Again, Honorable Sotobe, your network is compromising us. Can you continue? We'll add the seconds.
Can you hear me now, Chair?
Not a second.
Our 5 minutes.
We have built quite a number of infrastructure that never existed. We've improved the life expectancy of the